First of all, I just want to start by saying I myself did not choose to start using leucovorin for children with autism. I work for a doctor who has 30 years of experience and who also has colleagues that he talked to. And as his practice, he decided that for certain ones of his patients, he would provide leucovorin. So I made a video saying that we just prescribed it to one of our patients with autism, and we're going to see them back in a month and see how they're doing. Those of you that don't know, some studies have shown that some children with autism have cerebral folate deficiency, which is like a deficiency of folate in the brain. To sum it up, it has something to do with the transport system of folate into the brain. This is where leucovorin comes in. It bypasses that system and allows you to kind of rebuild that folate into the brain. Not every kid with autism has a cerebral folate deficiency. Obviously, you can't go around testing every child's brain to see if they do have this folate deficiency. Leucovorin and the studies that are on it right now have shown limited side effects, mostly just some GI things. Yes, it has not been researched well for long-term use, but as a mom who has a kid with kidney disease who started giving them a medication that didn't have long-term research, sometimes we as parents decide to do what we think is best for our kids. That's where this comes in. In no way, shape, or form are any healthcare providers saying studies show that it's safe and effective long-term. This is where risk versus benefit comes in, and a provider has a conversation with the parents. They tell them, this is what the research has shown thus far. It is very limited. There is no research showing that this is definitely going to help. There is no research showing that this is 100% safe in the long term. That's why some providers are offering it, and parents are deciding whether they want to make that decision for their children or not. Small-scale studies, leucovorin has shown some improvement in verbal communication, expressive communication, social interactions, decreasing hyperactivity and irritability, and some other autistic characteristics. So while yes, there needs to be more research on this, no, leucovorin is not the answer for everybody. No, not every provider is going to start giving it to every autistic child. Some providers and parents might decide together that benefit might outweigh the risks for them, and they might decide to try it for their autistic children. Once again, make sure that you are always talking to your trusted healthcare providers about your healthcare decisions.